So I'd like to introduce our next speaker today. It's Nick Trott, who is my friend and colleague who I am lucky to work with. He's internationally known for his work in celiac disease, and he specialises in celiac disease, gluten ataxia and disorders of gut-brain interactions. He has a Master's in Clinical Research from Sheffield University, and he was the winner of the Complete Nutrition Celiac Professional of the Year in 2017. So please welcome Nick to the stage for his talk on a National Celiac Disease New Patient webinar.
Thank you so much, Christian, for that introduction. It's wonderful here today, and I hope you're all enjoying the day and thinking of interesting questions for us this afternoon. So I'm Nick. I help support the Celiac service here in Sheffield, and today I want to talk a little bit about our recent project in the development of a national webinar for newly diagnosed patients. So I want to cover a little bit about treatment issues in celiac disease that lead on from Rachel's talk, about dietetic input to celiac disease that leads on from Christian's brilliant talk this morning, and then try and justify why we need a national webinar or another webinar. I want to talk a little bit about the content and functionality of what we're doing and what next, and why we really want dietitian buy-in to this at a national level to support this project as well as support patients going forward. So I just want to emphasize a little bit about a very recent study. This is hot off the press. It's just come out last week, and it's a large web-based survey in Norway. Large numbers, almost 4,000 patients after a year of being on the gluten-free diet post-diagnosis. And what they've done is they've used the Celiac Symptom Index, which is a way of monitoring your quality of life on a gluten-free diet, as well as your adherence to the gluten-free diet. And you can see there's a little bit of a disparity and difference about quality of life in this measure. So you've got people with a high quality of life, moderate reduced, and a poor quality of life, and maybe a poor adherence to the gluten-free diet. And I think that what I would take from this study is we have a very heterogeneous group here. You know, we can't lump all patients with celiac disease into one group and say they all respond in the same way, or they all have the same quality of life or response to the gluten-free diet. There's nuance, and how we apply our limited dietetic resource to this group really needs to be reflected in what we're seeing through the natural course of the disease. And again, in this paper, patients had 40% of them had persistent ongoing GI symptoms. And these are the patients I would argue, if you would let me, really need our individual one-to-one support. Now, here's another paper, again, just recently out a couple of weeks ago. This is a international retrospective study over a 5-year period. And what they found is about 70% of patients had ongoing GI symptoms. But they did a sub-analysis looking specifically at about 145 patients. And what they gained from this, they were looking at patients on repeat biopsy. You either had an abnormal biopsy or no symptoms, or ongoing symptoms associated with an abnormal or ongoing villus atrophy. And what I draw your attention to is classes 2, 3, and 4 here. That's about 60% of this cohort, about 90 patients. These are patients, for some reason or other, weren't applying the diet, or they may have had co-occurring functional gut symptoms. So in this 60%, again, they're going to need individual care. And the outcome of this paper, the authors were highlighting this. There's a need for more routine follow-up, and I would argue there's a need for more one-to-one routine follow-up in specifically selected patients. And I think we need to take this forward as dietitians work in this area as a group. Now, you've seen some brilliant data from Rachel's talk about the increase in diagnosis. Again, this is a paper pretty hot off the press in pediatrics. We're all aware of the iceberg. I know we all use icebergs for limitation of diagnosis in celiac disease, but it is a sorry state of affairs that maybe up to 70% of people remain undiagnosed. Now, the headline take-home from this study was prevalence is now significantly higher than what we used to think of it at 1%. It's probably 1.6%. And this is going to present service delivery challenges in celiac disease. We don't have enough specialist dietitians in the area. There is a large cohort of patients who remain undiagnosed with the concomitant comorbidities and reduction in quality of life, but there is an increase in prevalence and diagnosis. How are we going to manage this going forward, I think, is an important question in the area. And I think this leads on to best practice. And I would hold Christian's brilliant talk up as an example of best practice in the area. In celiac disease and treatments, if something is effective, a gluten-free diet is effective, I would always ask the question, effective for whom and under what circumstances? And in my mind, a gluten-free diet is effective for someone who's appropriately diagnosed with a gluten-related disorder, And under what circumstances, I would say under the care of a specialist dietitian is optimal in terms of the circumstances they should be under treatment. That means we maximize the potential benefits of improving quality of life and improving mucosal healing and correction of deficiencies and limiting the risk of potential cancer diagnosis. But in terms of the challenges, food-related anxiety, cross-contamination, socialization, just like Christian highlighted, this is all improved by dietitians. But we need to be targeting our practice. With a limited resource, we need to box clever, if you like, and think how we apply our services. So, again, you'll all be aware of this, about the fact that maybe there's only a third of the dietitians there should be in this area. Patients may be only getting followed up for a limited period of time, and that came out of our data, our national survey. So I would put forward this, if you like, infographic to explain this. We've got a treatment requirement, and we've got a distribution of different treatment and symptom burden within the celiac cohort. And we've got limited dietetic capacity. So shouldn't we be targeting our capacity for one-to-one at the people with the biggest treatment burden? That's what I would think we should be targeting our individual practice. And for other people, for people with maybe in a different situation, we could target their education in different ways. And one of the ways we could do this would be with a patient webinar for newly diagnosed patients, and that's what we've developed. We've been lucky enough to develop this with colleagues again from Somerset, and also have Christian from Bradford involved, as well as myself and Professor Sanders. And I want to just give you a little bit of reason why we've done this. So you may have some questions. And I had some of these questions as well. So one of the reasons you may say why is we already have a brilliant, amazing, comprehensive new patient webinar developed by our friends and colleagues in Somerset, Leah Smaymark, Marianne Williams and her colleagues. And this is a brilliant webinar. And we instantly pretty much went to them and asked them for their guidance and expertise. They are the innovators. They are the experts in this area. And we very much want to work collaboratively with them, which is what we're doing. And ultimately, part of this work, we want to develop a study that hopefully will demonstrate a non-inferiority between webinars and individual treatments. We've done this before for groups. So it's a non-inferiority study trying to demonstrate clinical equipoise and parity between the two treatments. And very much want to work nationally on that. Equally, we recently it was a real honor to become the National Centre for Refractory Celiac Disease. And as part of that, we were required to develop some resources around celiac disease, like a webinar for patients. I'm also working on the celiac disease outcomes in dietetics, along with Christian and Yvonne Jennings from Roehampton and myself. And as part of that, we're looking to develop and collect and report on specific related outcomes in celiac disease, in dietitian outcomes, traditional face-to-face, as well as telephone clinics and also webinars. So there's a number of reasons why we wanted to develop this project, and I hope that convinces you that it's something we should be doing. So I just want to give you a little bit of a flavor of how this is developed. We've worked with a wonderful creative design team who have extensive experience in working on NHS websites. And we went to them and we explained we wanted to develop a webinar for celiac disease. And they came back and said, should we base it on this meme? We kind of explained to them that actually we wanted to expand it out a little bit from this. And there are some very good gluten-free pastas out there. Shout out to the sponsors. So we wanted to develop a webinar, really, that covers the diagnosis, how common it is, give patients a foundational background. We know from working one-to-one with this cohort that patients really want to understand what celiac disease is, not just how to apply the gluten-free diet. So we wanted to cover all those bases. And I want to just give you a little bit of an insight and a vignette. Obviously, we can't give you the whole webinar at the moment, but just to show you some aspects of what we're aiming to do. So we're going to use some animations that we're really impressed with to explain the diagnosis. Here you have gluten crossing the gut wall, and then that releasing lymphocytes and infiltration of lymphocytes. And then over time, obviously, that's leading to inflammation and then potential villus atrophy over time. So we want to use these sort of infographics and these animations to help explain it, and that's what the webinar is there to do. Equally, we were very lucky to have Professor Sanders involved explaining the medical aspects of this, so looking at blood tests, explaining biopsy to patients, and genetic tests and everything, and going into detail about how it's diagnosed. And equally, looking at the potentiality for non-biopsy diagnosis, which has obviously come up as an interim measure during the pandemic, so covering those things as well. And equally looking at the need for bone scans and how that should be carried out and how should that be screened for, and the need for vaccination. So having a thorough cover of the medical aspects, and we were very grateful to Professor Sanders to come and do that. Equally, I was really grateful for my colleague Christian to come on board with us, and he helps explain what gluten is with his now legendary and I think potentially copyrighted BROW acronym, barley, rye, oats and wheat. So we're really grateful to have him on board to come and speak on this. And he also does a brilliant section on looking how you can assess whether you can tolerate gluten-free oats and the potential risk of that or how common it is, and equally looking at cross-contamination at home. So we were very grateful to Christian to come on board and do this. The other aspect to this, though, is the functionality of the website. This is an NHS-protected website. What we're able to do is input patient demographics, patient data, the NHS trust they were diagnosed in. When we're having patients using this webinar at a national level, dietitians will be able to go in and search their trust and search for the patients this has been recommended to, as well as the data they collected about their knowledge pre and post the webinar. So you will be able to assess, how did your patient do? What is the knowledge they've gained before seeing them in the review? And I think this is crucial to what we want to do. We want to be able to collect that data in a safe way, and that's what we're going to be able to do. Equally, we'll be looking at quality of life measures. Initially, we're going to be using the EQ5D, which is a very validated tool in this area, looking at mobility, self-care, daily activities, pain and discomfort, and the levels of depression and anxiety. And we want to do this again. If we can do this at a national level, the data we can collect will be so powerful to justify what we do in this area clinically. Equally, we'll be looking at symptom burden, of course, pre and post, hopefully in follow-up. And like I say, levels of comprehension, looking at how we can assess patients' knowledge pre and post. So there's a number of different functionalities to the website that hopefully we can use at a national level. So what next? Well, I think the crucial thing is here, we need buy-in from dietitians at a national level. We've developed this resource with colleagues, and really what we want is dietitians to take this on board. The website that we're developing could be a real hub nationally for us in this area in terms of collecting data, giving education to the patients. One thing we want to look at is obviously language translation. We know from the evidence base out there that people who are non-English speakers really struggle with the diagnosis and applying the diet. If we can translate this webinar to other languages, that's going to be a benefit. Feedback and data, collecting data from patients as well to help research, but ultimately for patient benefit. And then we want additional content. We could do things maybe like supermarket tours. Equally, one thing we're going to be looking at is, excuse me, is an online Q&A, hopefully weekly, where dietitians who are interested in the area will come on and answer questions for patients, and using a similar Q&A that we've used today, we've got the expertise to do that, as well as developing information about other gluten-related disorders like gluten ataxia we've heard about today from Professor Hydrovasilou, and maybe non-celiac wheat and gluten sensitivity, and then having public patient involvement as well. We're really keen to ensure that we're having feedback from the patients, and that's directly influencing how we take this forward. So hopefully I've convinced you today that it's a useful resource that we can all buy into as dietitians naturally with interest in the area. Please do contact us if you're interested. This is going to go live in the next couple of months, and we really want to take this forward and run with it and see if we can develop this as a national resource. Now, I just want to finalize by thanking all my colleagues here, but just a little bit of advert. I know we couldn't all get together today, but we're so close to hopefully things getting back to normal. And in 2023, we're fortunate enough to be hosting the International Society for Celiac Disease Symposium. And we'd like to all welcome you to our city in 2023. And hopefully we can show you some of the cultural and social delights of Sheffield in person. So more than happy to take any questions, and thank you for letting me talk.
So thank you very much, Nick, for a fantastic talk. I would like to open the floor for any questions. We do have a couple of questions that have come through online. Asking Nick regarding the availability of the webinar, will it be UK-wide or will it be national?
It will be, my understanding is it will be UK-wide.
Okay.
Yeah, and available for everyone.
Any questions?
Can I just ask a question? Will it be free to use so people can just access it completely free? That's brilliant. Yeah.
Yeah, absolutely.
Also, Nick, I wonder how will we maximise engagement and also reach of this fantastic webinar?
I think that's a really important question about dissemination. I think this is where we really need dietetic ownership. I think we try to put this together as the best package, educational package we can to support dietitians in the area. And the point I'm trying to make with this, if we can disseminate this through colleagues, talks like this and other ways, then we can target our limited one-to-one resource to those patients that may have higher treatment burden, as well as giving a standardized message to other patients. So I think we need to disseminate in a number of ways.
Thank you.
Nick, question from Slido. What was the role of Celiac UK in the development of this website?
Yeah, so Celiac UK were on board from the very beginning. We've put all the slides and the information to them, and they've given us direct feedback, and they're happy with the way we've developed the webinar. Of course, there's always a project like this is always going to be a case of further development, and we'll be certainly looking to develop that in future as the evidence base changes. But Celiac UK are completely involved and on board with this as a national project.
One final question. Yeah. When will people know when it's available?
Hopefully, we're just doing the final processings, I would hope, in the next 6 to 8 weeks.
One last question. Website address for it?
Yes, it's in the talk, but I will put it up. We will disseminate it through our we have everyone's email for the symposium, so we can distribute it that way as well.
Thank you, Nick, for a fantastic talk.
Thank you.